A new virus is making waves in China, sparking concerns and raising questions about its potential impact. The virus, called Human Metapneumovirus, or HMPV, might not be as well known as COVID-19, but it's causing significant strain on healthcare systems. So, what exactly is HMPV? Is it something we should be worried about on a global scale? Or is it simply a seasonal illness being overhyped? You're watching Elite Global Watch, where we simplify the complex and reveal the hidden. In this video, we'll unpack the facts, explore what's happening in China, and discuss whether this virus could become a global concern. Stay tuned, let's get started. What is HMPV? So, what is Human Metapneumovirus, or HMPV? Simply put, it's a respiratory virus that's been quietly circulating for decades, often flying under the radar. First discovered in 2001, HMPV primarily affects young children, the elderly, and people with weakened immune systems. This virus is part of the same family as RSV, respiratory syncytial virus, and causes symptoms that might feel very familiar: coughing, congestion, fever, and difficulty breathing in severe cases. Think of it like a mix between the flu and the common cold, but for some, it can hit much harder. HMPV's symptoms often overlap with other respiratory illnesses, like the flu or RSV. Fever? Yes, just like the flu. Runny nose and congestion? Check. Sore throat and cough? Very common, but unlike RSV, HMPV is less likely to cause severe lower respiratory infections like pneumonia in healthy individuals. However, in children under 5, the elderly, and those with pre-existing conditions, it can lead to complications requiring hospitalization. And while it might not sound too different from other seasonal viruses, its ability to quietly spread in communities is what makes it worth paying attention to. Understanding the basics is just the first step. Let's now explore what's happening in China and why HMPV is making headlines. Here's what you need to know about the current outbreak. Current outbreak in China. In recent weeks, China has been grappling with a surge in cases of Human Metapneumovirus, or HMPV, creating significant strain on its healthcare system. The outbreak has been especially concerning in children, who are among the most vulnerable to this respiratory virus. In provinces like Hunan, hospitals have reported being overwhelmed with young patients suffering from respiratory symptoms. Beds are filling up quickly, and families are waiting in long lines for medical attention. The scenes echo memories of past health crises, raising alarms both locally and internationally. Chinese health authorities have acknowledged the uptick in cases, attributing the rise to seasonal factors and increased indoor activities during the colder months. They've emphasized that while HMPV can be severe for some, it's not a new virus and doesn't pose the same pandemic threat as COVID-19. In response, hospitals are ramping up their pediatric care units, and public health campaigns are urging parents to monitor symptoms closely. Authorities are also stressing the importance of hand hygiene and mask wearing in crowded places to curb the spread. But with hospitals stretched to their limits and little public awareness about HMPV, is this outbreak a sign of something bigger? Or is it just a seasonal spike that will soon pass? Let's explore how this virus spreads and what you can do to protect yourself and your family. How is HMPV transmitted? Like many respiratory viruses, Human Metapneumovirus, or HMPV, spreads through the air we share. Tiny droplets packed with the virus are released when an infected person coughs, sneezes, or even talks. Those droplets can land on surfaces, or worse, be inhaled by someone nearby. But that's not the only way HMPV gets around. It can also spread through direct contact, think handshakes, hugs, or touching surfaces like door handles and phones that harbor the virus. And once you touch your face, it's a one-way ticket to your respiratory system. HMPV also has a seasonal rhythm. It tends to thrive in colder months, often peaking in late winter or early spring. Why? Because during this time, people spend more time indoors in close contact, creating the perfect environment for the virus to spread. Imagine crowded schools, bustling offices, or packed public transport during winter. These are the hotspots where HMPV loves to spread. But unlike summer viruses that thrive outdoors, HMPV capitalizes on our need to huddle indoors when temperatures drop. Prevention and management. Prevention is your best defense when it comes to Human Metapneumovirus, or HMPV. While there's no specific antiviral treatment or vaccine for this virus, simple actions can make a big difference in staying healthy. First and foremost, hand hygiene. Wash your hands regularly with soap and water for at least 20 seconds, especially after being in public or touching shared surfaces. Can't find a sink? Keep a good hand sanitizer handy, it's your portable line of defense. Next, avoid crowded places when possible, especially during the peak winter and spring seasons when HMPV tends to spread. If you need to be in public, like on a packed bus or at a busy event, wearing a mask can help protect you from respiratory droplets. And let's not forget the basics. Cover your mouth and nose when you sneeze or cough, and clean frequently touched surfaces like phones, doorknobs, and keyboards. If you or someone you know does catch HMPV, supportive care is key. This includes staying hydrated, getting plenty of rest, and using over-the-counter remedies to manage symptoms like fever or congestion. For severe cases, especially in young children or the elderly, seeking medical attention is crucial. Here's your HMPV prevention checklist. Wash your hands regularly. Avoid crowded places. Wear a mask if needed. Disinfect frequently touched surfaces. Rest and stay hydrated if you feel unwell. Taking these simple steps can keep you and your loved ones safe. In our final section, we'll explore the global implications of HMPV and why staying informed is so important. Let's take a closer look at the bigger picture. Global implications. Whenever we hear about a virus outbreak, especially in a major country like China, the first question that comes to mind is, could this go global? For human metapneumovirus, or HMPV, the answer is a bit more nuanced. Unlike COVID-19, HMPV doesn't have the same pandemic potential. It's a slower-moving virus, and outbreaks are typically seasonal and localized. However, with international travel back in full swing, there's always a chance that cases could appear in other countries, especially in regions with a lot of travel to and from China. At the moment, there are no major travel advisories related to HMPV. But if you're planning a trip, especially to areas experiencing outbreaks, it's a good idea to take precautions. Wear a mask in crowded places like airports, practice good hand hygiene, and avoid close contact with people who seem unwell. On the global stage, public health organizations are keeping a close eye on this outbreak. The World Health Organization and local health authorities are monitoring case numbers and working to provide updates on any developments. Their goal is to prevent unnecessary alarm while ensuring people stay informed and prepared. So, while HMPV is unlikely to disrupt daily life on a global scale, staying informed is key. Keep an eye on credible sources for updates, especially if you're traveling, and follow the basic preventative measures we've discussed. In our conclusion, let's wrap up what we've learned and why it's important to stay aware, even if this isn't a global crisis. In conclusion, as we wrap up, here's what we've learned. Human metapneumovirus or HMPV is a respiratory virus that's been around for decades, primarily affecting children, the elderly, and those with weakened immune systems. While the current outbreak in China has raised concerns, it's important to remember that this is not a new or unknown threat. Unlike COVID-19, HMPV doesn't have the same potential to become a global crisis. The situation in China highlights the importance of prevention and awareness. Hospitals in affected areas are busy, but public health measures and supportive care are helping to manage the outbreak effectively. So, what can you do? Stay informed, take simple precautions like washing your hands and avoiding crowded places, and keep an eye on updates from credible sources. Knowledge is our best tool for staying safe and prepared. If you found this video helpful, give it a thumbs up, subscribe to our channel for more updates on global health and current events, and share this video to spread awareness. Have any thoughts or questions? Drop them in the comments below. We'd love to hear from you. Thank you for watching, and stay safe out there.